Okay, let's dive right into this explainer and confront a pretty terrifying high-stakes reality. Picture this. You're at work, and suddenly a colleague collapses right there on the facility floor. In a matter of seconds, the environment turns completely chaotic. Now, this is a moment where hesitation doesn't just cost lives, it massively exposes your organization to severe liability and compliance violations. Most untrained bystanders totally freeze in these emergencies because they're absolutely terrified of doing the wrong thing. But by the end of this, you won't be one of them. We're going to master the critical ABCs of workplace first aid so you can step up confidently when it actually matters most.
Because listen, the absolute second someone hits the floor, you're facing a relentless countdown. It's a literal ticking clock. A patient who stops breathing will go into cardiac arrest within mere minutes, and shortly after that, we are looking at irreversible brain damage and permanent biological death. Emergencies simply do not wait around for you to go find and consult the safety manual, right?
So to truly understand how to respond, we have to view the human body like a biological machine. The cardiovascular and respiratory systems have to operate continuously. They are deeply, deeply linked. Think of it this way. A continuous, unbroken supply of oxygen is absolutely non-negotiable for survival. If either of these systems fails, that person's life is in immediate danger, and you literally have to step in as the temporary replacement for those failing systems. That's exactly why the ABCs are your absolute first priority in any primary assessment.
All right, so step one is the airway, clearing the path. If the physical path from the outside atmosphere to the lungs is blocked, which is most commonly caused by the patient's own tongue just dropping to the back of their throat, they simply cannot breathe. Now, for a normal collapse, it's pretty straightforward. Place one hand on the forehead, the other under the chin, and do a head tilt chin lift to physically pull that tongue right away from the windpipe. But, and this is absolutely crucial, if you suspect the patient fell and maybe suffered a spinal injury, you must strictly use the jaw thrust maneuver. This pushes the jaw upward to open the airway without bending their fragile neck. Moving right along, step two is breathing, the oxygen exchange. Okay, so once that airway is open, your main goal is to make sure life-saving oxygen is actually entering the tiny alveoli in the lungs and that toxic carbon dioxide is leaving. You verify this by quickly scanning the chest to see if it's rising and falling normally. But remember that ticking clock we talked about? You should spend a maximum of 10 seconds checking this. Don't linger. Lean over, look really closely at the chest, and listen for any weird sounds of respiratory stress, like gurgling or wheezing. Now here is a massive pro tip. This is what really separates trained responders from dangerous amateurs. Do not mistake agonal gasps for normal breathing. Untrained folks often get totally tricked by this irregular, unnatural gasping and think, oh great, they're breathing. Actually, no. These gasps are a glaring physiological red flag for cardiac arrest. If they are gasping like this, they are not breathing normally. So if they aren't breathing normally, you have to intervene immediately. Grab your company-issued PPE, specifically a CPR pocket mask or a single-use one-way valve face shield. Get a really secure seal with your mouth over the barrier. Now follow these exact steps. Blow into the airway just enough to make the chest rise, and deliver those breaths at a deliberate rate of 1 breath per second. And a critical warning for you here, do not blow with excessive force. If you blow too hard, you'll actually force air right past the lungs and into the stomach. That causes gastric inflation, which usually leads to vomiting, and boom, you've just reblocked the airway.
Step 3 is circulation, replenishing those systems. You've got to ensure the heart is actively pumping about 4 to 5 liters of blood per minute in a continuous cycle, carrying oxygen through the arteries to replenish all the vital organs. How do you verify this biological pump is still working? Well, target a normal adult pulse of 60 to 100 beats per minute. Find the carotid artery. It's right in that little crevice between the windpipe and the neck muscle, and feel for 5 to 10 seconds. Alternatively, you can check capillary refill. Just press down on the patient's nail bed until it turns white. The pink color needs to rush back in less than 2 seconds. But please remember this absolute, unbreakable rule. You cannot build artificial blood pressure with chest compressions if the system has a massive leak. If a major artery is severed, blood is going to spurt out under immense high pressure. This catastrophic bleeding will completely compromise all of your circulation efforts and literally render any CPR you do absolutely useless. So major arterial bleeding must be stopped before you do anything else. Use direct, firm pressure or apply a tourniquet immediately.
Step 4, the CPR standard, also known as basic life support.
Right, so if there's no pulse, no catastrophic bleed, and the heart has completely stopped, you've crossed a critical threshold. You must now manually mimic the heart's pumping action. You literally become the biological pump for them. The uncompromising standard here is a strict ratio, 30 to 2. That means exactly 30 firm chest compressions, immediately followed by 2 measured rescue breaths. This continuous cycle is the only thing artificially forcing blood through their arteries to keep their brain and organs alive until professional help arrives.
And let me tell you, technique is absolutely everything here. Place the center of your hand right on the lower half of the patient's sternum and interlock your fingers. You need to compress exactly 5 centimeters deep to successfully squeeze that heart against the spine. And you have to maintain a rapid rate of 120 beats per minute. That is 2 full compressions every single second. You are forcefully maintaining blood flow, and you just cannot let up.
Finally, step 5, workplace compliance and EMS activation. Saving a life is obviously the priority, but protecting corporate liability and legal standing is the vital next step in any workplace scenario. And honestly, you can't do this all alone. Delegate a specific bystander, point right at them, and tell them to activate South African EMS. Have them dial 10177 for an ambulance or 10111 for the police. While they do that, you must operate strictly within your training scope. Do not try a procedure you aren't actually certified for. By maintaining OHS Act compliance and relying on certified first aiders, you preserve not only the patient's life, but also the company's legal chain of custody.
So, I want to leave you with a really crucial thought to consider about your own workplace readiness today. When that countdown unexpectedly begins on your facility's floor, is your team actually certified and ready to preserve life? Because, as we've seen, emergencies simply do not wait. They don't schedule an appointment, and they sure don't give you time to pull up a quick tutorial on your phone. Certify your designated responders today, secure your compliance, and ensure that when that ticking clock starts, your team is ready to act.